My son, he was what, maybe 3 when it happened. I was coming out, he was walking in the door, and he got the door knob just landed right in the eye and busted it open. So I'm like, where can I go? And I looked really quick, and I'm like, all right, Dr. Blau. So I said, let me just go there. It's right around the corner from my house. He was really good, you know, with my son and how it healed, and he seemed really nice. 5, 6 years later, I said, you know, I'm gonna go back to him. So that's when I came back to ask him questions about what I needed to get done for myself.
Dr. Blau is board certified and one of the leading plastic surgeons in the field.
In every tummy tuck there are like 2 scars. One scar is right in the lower part of the abdomen, and it goes usually from side to side of the abdomen. Sometimes it can be a little shorter. And one scar is around the belly button. Again, everybody heals differently. In general, I would say the success rate is very high, and I would say over 90% are very happy with the results.
The reason why I really, I want to get this surgery done is because it's just emotionally, it's bothering me day in, day out. I see myself, I don't even like to look at myself. No matter how much I exercised or worked out, the skin just hung there, and it was very I didn't like looking at it, let alone somebody else looking at it. But everybody said it was fine, but they're not living with it.
Surgery is done for you, not for your husband or your boyfriend or anybody else. You have to live with this ultimately, and so you are the only one that should decide.
Before and after photos are crucial to consider when deciding on a plastic surgeon. There are hundreds of them on Dr. Blau's website.
We'll examine you and we'll see exactly what you can do if you're a good candidate for the surgery.
No, I will. I will be.
Okay.
I'll be a good candidate.
Seeing you very motivated,
yeah.
Which is good. So just to show, the scar is going to be from about here to here.
Okay.
As a model, Michelle has graced the covers of many prestigious magazines. She spent 7 years traveling the globe. But once marriage and children entered the equation, things changed.
People say you should get back into it, but it's so time-consuming. Like, you just have to be on call, and I can't just leave the country, and I can't just pack and leave anytime I want. My full-time job is my children.
After giving birth to her 3rd child, Isabella, Michelle realized that the only way to rid her stomach of excess skin was to have the tummy tuck procedure.
I love my wife very much, and I know this was something that was very important to her, that she wanted to get done. I can understand being a woman, me being a man, certain things that bother you, so I can understand for a woman how important it was to be able to be a kid again and feel like a teenager, wear a 2-piece bathing suit. We've been married for like 2 years. I always seen her in a 1-piece because she was so conscious of it.
Now it's going to be in where my underwear line is?
Yeah, it's going to be a bikini scar.
Okay.
One thing that I'm telling the patient, they have to weigh everything. They have to think like this: okay, I have this excess skin, the wrinkle, excess fat. Do I want to live with this the rest of my life? Because most of those people lost weight, and that's about what they can do. Excess skin doesn't really react. If you lose weight, you still have the excess skin on the wrinkles. So they really have to weigh it on a scale and put on one side, I'm going to do it, the other side, I'm not going to do it. Then if I'm not going to do it, I have to live like this the rest of my life. If I'm going to do it, then I'm going to have scars, which may be excellent, maybe not. People know what bothers them more, a scar or the way that the tummy looks before the surgery. You tackle 3 layers. You tackle the skin with the fat, and then the muscle and the fascia. Fascia is the envelope of the muscle.
A vast knowledge of the anatomy and physiology of the body is, of course, crucial. However, an artistic eye is perhaps the most essential tool of a plastic surgeon. By his own admission, Dr. Blau would not be an efficient plastic surgeon if he were not a world-class sculptor and painter. In his waiting room, there are many examples of his artwork.
I actually walked into his office and I saw like really pretty paintings and sculptures, and he had a really good eye. Hi, Dr. Blau.
Hi, Michelle.
How are you?
Okay, how are you?
Good, how are you doing?
This beautiful girl. How are you doing?
Absolutely fabulous. I'm
That is-
very, very happy.
It's great. I love people like this. I
Yeah.
love patients like this.
No complaints here. You have no idea.
So if you're at all uncomfortable with your stomach, feel free to contact us. We're here to help.